pancreatic cancer is one of the
leading
global
cause,
threats.
yes, correct.
Yes, one of the leading causes of death is because it's very, very hard to be detected early on. The tools are maybe not here yet, unfortunately, except for jaundice. There is no other visible symptoms. That's why it is very, very, very dangerous. And here's a grim reading for you. The Global Cancer Observatory 2020 report by the WHO, World Health Organization, provided statistics for Malaysia. 2 out of 100 newly diagnosed cancer cases were due to pancreatic cancer. Okay, that's fine. But only around 3 patients diagnosed in the past 5 years for every 100 people remain alive. And that is a very grim reading, ladies and gentlemen. It does kind of mean that if you have it, it's very, very bad for you. But you know what? That's why we are having this discussion. We want to spread awareness, and we also want to talk about the treatments and also how to combat this.
Yeah.
So we have an expert in the studio today.
Exactly. And before we bring that expert on the show, Nabil, always remember that as much as it's literally bad for you, but it's not necessarily doomsday just as yet. Simply because when it comes to awareness, how you can actually combat, how you can actually prevent not just yourself, but everyone around you, especially your loved ones. When it comes to pancreatic cancer, how you can actually, move in a way that you could slowly try to avoid it. Of course, we can do that as well. So we brought someone on the show who will talk to us about the risk factors, about what are the things that you can do, awareness, which is actually very important. So this person is a globally renowned gastroenterologist and also advanced endoscopist with over 24 years of experience in the field. Now, his clinical expertise is in the areas of colorectal cancer, pancreatic cancer, and cancer of the GI tract. Nabil, you want to bring the person on the show? Let's go.
Oh, okay. We have the, excuse me, consultant gastroenterologist from the Prince Court Medical Center, DATUK Dr. Ryan PONNUDURAI. Welcome to the show.
Thank you very much.
Sorry for that messed up introduction.
It's okay.
It's a very heavy topic right now. We are getting scared as well.
I know.
Because you just told us when it comes to not sleeping well, it can be a problem.
Yes.
Okay, so Nabil, are you like guilty right there? But
I am kinda, to be honest, I do sleep late, but that could be one of the causes of pancreatic cancer, unfortunately, doctor. So why don't we start with, let's talk about the organ itself. Let's talk about pancreas.
Yes.
Where is it located in the body and what does it do?
Yeah, thank you.
And apparently, sorry doctor, pancreas is like, apparently is the organ that is, like what doctors would say, if I'm quoting it wrongly, but pancreas is one of the organs that is wasn't pancreas, sorry, it's something else. But tell us about pancreas, what does it do?
So thank you both. Basically, the pancreas is an organ located underneath the stomach. It's about 15 centimeters long, and I call it the sleeping tiger. You don't want to wake up the pancreas. And how can you wake up the pancreas? By insulting the pancreas.
Wow.
So how do you insult the pancreas? Well, lifestyle. We talked a bit about lifestyle earlier. So lifestyle is something which it's a risk factor for problems in the pancreas. So unfortunately, alcohol is something which you should try and avoid because that can irritate the pancreas. Smoking is something which also can aggravate the pancreas. So the organ itself is an incredible organ because it functions to produce hormones, for insulin, for sugar regulation. It has enzymes which digest proteins and fats. So it's an incredible organ, but you just don't want to wake it up.
So when it comes to food, acid reflux, etc., can that wake the pancreas up?
Yeah. So what you mentioned about sleep, I was actually more with acid reflux and our lifestyle. The Malaysian lifestyle is something where we don't regulate meals. We eat a lot of processed food, processed meats. We take a lot of coffee, fresh brew, but unfortunately coffee can cause a lot of acid reflux. You got a picture there showing the organ, which is the pancreas, and it surrounds the intestine, as you can see, and the organ slightly to the right of it. The yellow is the pancreas, on the right of it is the spleen. And then you can see the gallbladder, which is a little capsule-like green there, and it's got a bile duct which connects into the pancreas and then into the duodenum. And so you mentioned, Nabil, about jaundice. So if you block the head of the pancreas, so if you look at the pancreas as a head, neck, and tail, it looks like a hockey stick, doesn't it? It looks like a hockey stick, inverted hockey stick. So if you block the head of the pancreas, the bile doesn't flow, and then you become yellow. So this is the problem with this organ. And when you develop, unfortunately, when somebody develops pancreatic cancer, there's no symptoms till it's too late. And that's why the diagnosis is important, that we figure out early on what's going on, and therefore we can institute the right care for prolonged survival.
I wonder, doctor, if you can just enlighten us, what do you mean by you do not want to wake up the sleeping giant, the sleeping tiger?
So what happens is when this organ gets inflamed, the pain of pancreatitis is probably up there in the top 3 pains you can ever have. Kidney stones is one, bile duct stones, and pancreas. When you get the pancreas inflamed, the pain is excruciating. The pain goes from the abdomen right through to the back. And it's and what happens is the enzymes get produced outside the pancreas, and these enzymes break down fat. So it actually causes necrosis, which means it burns the fat around the pancreas, and it can be quite bad.
Oh my goodness.
Yeah, I'm so sorry. I mean, to say this in the morning, but unfortunately, that's it.
No, we
Well,
must
it's
discuss
awareness at the end of the day, right?
Yes.
It is, yeah.
Yeah. So let's talk about pancreatic cancer when it comes to the stats, when it comes to all the numbers and figures given by the World Health Organization,
Yes.
and etc. Tell us more about pancreatic cancer. Why is it like very difficult to actually diagnose it?
Yeah. So it looks like there's been a shift, a paradigm shift from Western illnesses to Asian illnesses, and I call that globalization. I think we are now seeing more and more illnesses which were predominantly in Western Europe and America coming to Asia. And I think it's our lifestyle. Again, it's our traveling. And so there's an element of that because pancreatic cancer in America and in Europe is in the top 5 cancer deaths. In Malaysia, it's still it's number 12. But I'm telling you, I think it's because it's underdiagnosed. So people don't know. And unfortunately, when you get this kind of cancer, we know the statistics are horrible. People are, there's a less than 5% survival rate after 5 years. So, you've got to try and get this diagnosis quickly. Now, what I want to explain to everyone is there's still light at the end of the tunnel. There is still hope. And the hope is to diagnose the type of cancer. So the type of cancer would determine the type of treatment. And we have means now of getting a tissue diagnosis. In the old days, we would say, okay, you're done. It's blocked, you can't do anything. But now we realize there are different types of pancreatic cancer. Steve Jobs. Now, Steve Jobs had a neuroendocrine, a hormonally driven cancer of the pancreas. And he lived. He lived for a good few years. He had a liver transplant. He had access to all of that. But he lived for more than 5 years. So there's, if the treatment can change according to the type of cancer, the type of cancer in the pancreas.
So when we talk about awareness, what are we looking from this? Maybe people actually go and get themselves screened more often, once a year, or probably, I don't know, once in 2 years. Yeah.
So we're looking at what are the risk factors. That's what you're really asking. There are some risk factors we can change, and there's some risk factors we can't change. The risk factors we can change is less alcohol, less smoking, less processed meats. These are things we have a chance to change. But what can't we change? Our race, our genetics, these things we cannot change. So when we talk about what we can't change, well, it's unfortunately, we can do genetic markers. We can look for what risks factors are available. Now, if you look at Indians, for example, the southern belt of India, and so the Tamil Nadu area, a lot of young people are getting what we call chronic inflammation of the pancreas. The whole pancreas becomes like chalk. It just gets inflamed over and over again. And so we were diagnosing 25-year-olds with pancreatic cancer. So this is a genetic belt. So being in Malaysia, we've got a significant group of southern Indian, population, and they are at a higher risk of genetic hereditary pancreatitis, which can lead to pancreatic cancer.
You mentioned that it looks like there's a bit of a surprise diagnosing cancer from a 25-year-old.
Yes.
Does that mean that pancreatic cancer, they usually affect those who are older?
Yeah. So I call the 50 to 60 the sniper time. So whatever you've been doing for the last 10 or 20 years is going to catch up with you in the 50s and 60s. So you guys got a few more years, so don't worry. Just change your lifestyle. You'll be all right.
Doctor, you're freaking me out.
He is indeed, to be honest, and it sounds very, I mean, it's a good warning for us because we still have a
got
good
time.
years
You still got good time, yeah? You got time
to
on
go
your hand.
before we're 50 and 60. And yeah, I mean,
You got to exercise. That's definitely something that you need to do before it catch up on you once again.
Yeah.
definitely. And all sounds very, very horrible. But let's say if you feel like you have it, what should that person do? What type of screenings are there?
Okay, so what are the symptoms? Basically, they're very vague. They could have abdominal discomfort, bloating, discomfort going to the back, weight loss. Weight loss for me is one of the signs which make me want to check. So weight loss, and just a feeling of being unwell. These are things which would want to trigger you to have a check. Diabetics, obese patients, patients who have a BMI is greater than 30. These are things which will predispose you to pancreatic tumors. So obviously, exercising, like you mentioned, Brendan, I think that's important. And obviously, a healthy lifestyle, less processed meats, very important. So these are things, and diabetes is so high in Malaysia. You've got so many diabetics, and so that transition, that high glucose level, the high insulin levels predispose you to cancer.
Right. So, Doctor, when you spoke about screenings, there are various types of screenings as well. Could you tell us what kind of screenings and etc.?
Yeah. So basically, you've got. So when do you start screening? Well, I think if you have a strong family history of pancreatic cancer, I have a family who of triplets, and 2 have pancreatic cancer and have passed away. So the lady I see every 6 months for scans. I do an ultrasound or I do an MRI, and she's very well. But it is definitely those kind of patients who have a genetic predisposition are those at a higher risk. What can we do? Well, we can obviously change lifestyle. Number 2 is to do regular ultrasounds and blood tests. So an ultrasound of the abdomen is an easy test to do. It's basically, you scan the abdomen, it takes about 5 minutes, and it tells us about the pancreas. Of course, I call it the Toyota of tests. Then you've got the Mercedes of tests, which would be a CT scan.
Right.
Then you've got kind of the Rolls Royce, which is the endoscopic ultrasound, which is something I spent many years learning and doing. It's basically a scope which goes down, and it has an ultrasound at the end of it. Now, a lot of people have had endoscopy before, a scope which goes down, and this is a new device. Well, it's been there for the last 10 years or so, but it's evolved into an incredible tool where we can scan the pancreas from the stomach, and then we can diagnose. We could put a needle in and get tissue, and then make the treatment more succinct for the patient.
Right.
This all sounds very, 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 I mean, they're horrible, right? I mean, they don't sound good. I don't like it, but I mean, obviously you mentioned just now that there are several types of pancreatic cancer.
Yes.
I wonder if there's any type that has better survival rate than the others?
Yeah, well, Steve Jobs' one was, and it still got him in the end. But I think if you get it early enough by a tissue diagnosis, now we can get the tissue, look at it, and then choose the right treatment targeted for the tumor. We all hear about targeted therapy in lung cancers and breast cancer and so on. Well, pancreas, it's coming. It's there. We are able to say, okay, now this tumor will respond to this kind of therapy. So there's still hope. We also shrink the tumor down before this surgery. Now, the surgery needed is a big surgery. It's called a Whipple procedure. And you can see on the picture here, you've got a normal, and then you've got the cancer, which is the growth in the pancreas. So what you have to do is you have to cut that whole area out. And it's a big operation because the pancreas is located right underneath many different organs. So to cut it out, you have to cut out the intestine, you have to cut out the head of the pancreas, you have to cut out half the stomach. I know, it's a bypass of many things. So it's the mother of all operations, I call it.
Wow. Okay. Wow. Okay.
Yeah.
So when it comes to treatment options,
Yes.
Doctor, what are the treatment options out there?
Okay, so what we bring now in the last 5 years is, as we mentioned, who might get it, but also by scanning, we're able to see what certain cysts. So I have to bring up this issue because I think a lot of people out there, because 3% of the world has cysts in the pancreas. Now, what are cysts? These are little fluid-filled areas. And in the old days, we always used to say a cyst can develop into a cancer. Now, with endoscopic ultrasound, I can assess the cyst and reassure the patient this cyst only needs to be followed up and not to be cut out. So we still need to subcategorize patients to see who's at risk and who isn't by these procedures. And the procedure, like I mentioned, is only 5 minutes. And you're sedated and you wake up, you don't know you've had it, you go home. So there's many options available to assess the patient, see whether this patient is at risk of a cancer, because certain cancers, like breast cancer, is linked to pancreatic cancer. So by doing endoscopic ultrasound in those kind of patients, I can then tell the patient, look, you're going to be fine. We will reassess you in 6 months to a year. So, it's not all doom and gloom. There's still hope. It's just subcategorizing and being aware. Now, you mentioned awareness. Awareness is so important. So people who have a family history, people changing one's lifestyle, and also the risk factors of breast cancer and so on are those are the patients we need to look more carefully. So ultrasound, CT, MRI, or endoscopic ultrasound.
Doctor, you just mentioned about the sniping age, right? The sniping time, sniping age, 50 to 60 years old. So that's the cap, right? So are you trying to say also as well that that age is when you should go and get checked, or can we do it before?
Yeah, I think that, we need to look at the Americans. The Americans, they're living to 90, and we can as well. Malaysia should, we should strive. And you can see our age survival rate is increasing, and which is great. There are more 85-year-olds, there are more 90-year-olds. Now, how do we do that? We need to start screening early. So 45 and above, you should go and get your health check, get your stress test done, get your cholesterol, get your sugar levels all under control, and you can live a great life.
Fantastic. Let's cling on to that hope, and maybe you can tell us a story about maybe a real-life account of a patient who experienced a better outcome due to early diagnosis, Doctor?
Yeah, we can. Well, basically, I've had, over the last 15 years, a lot of patients referred to me with pancreatic tumors. So we had a lady who we found a tumor which was only 1 centimeter, and we removed it, and she was on a world tour trip on a ship, and she was 80 years old. And she did a world trip, and she was really in good form, and we were able to control her symptoms and so on, and she had a normal life, and she passed away recently from other issues. So there's still hope. There's still hope based on early diagnosis, early resection, early treatment. So the chemo radiation is something patients will be aware of. It's just to try and make the tumor smaller so we can cut it out. So there are these kind of modalities available.
Okay, so yes, indeed, it's definitely light at the end of the tunnel.
Yeah.
Usually there's always light at the end of the tunnel. For me, can you maybe tell us, Doctor, about what are some of the recent advances or progress made in the treatment of pancreatic cancer?
So we need to try and use treatment which fits the patient. So I look at a patient not just from the cancer perspective, it's from the age as well, and their quality of life. I think, when you're diagnosed with this horrible illness, a lot of times the family need to understand as well. And I see there's sometimes a disparity between the patient and the family. The family want everything. The patient sometimes doesn't want, because they are accepting of the fact that they've got this. They want to have the best quality of life. And I look at that, and it's very important that we as doctors appreciate that. We as doctors aren't here to cure everything, but we're here to with our help, with our knowledge, to make the best choices for the family and the patient. So to me, I think each patient is separate and individual. And a lot of times, it's interesting that in my journey with this disease, that a lot of patients know there's something before they're told. Before I even disclose that information, they know. And so sometimes we don't, we talk to the family, they say, look, don't tell the patient. I always discuss with family, is that something the patient wants to know? And a lot of times, being in the culture in Malaysia, a lot of family feel, don't tell because it will ruin whatever their outcome and their aspects and so on of going forwards. But a lot of times the patients themselves know. So we look at the patient, and we also look at how we can help in the last few months of life. And that's really important. We've got an incredible palliative, we've got an incredible hospice care in Malaysia, which they come to the house to look after you. And that's the amazing part of Malaysia, of healthcare in Malaysia.
Okay. Wow. All right, thank you so much, Doctor, for actually sharing with us about pancreatic cancer when it comes to risk factors, the treatments, etc. Definitely, there is light at the end of the tunnel. When it comes to awareness, it's actually very important. So the early age of 45, that's where you should get yourselves checked often. Don't wait until it's too late, as I would say. Thank you so much, once again, Dr. Ryan PONNUDURAI, consultant gastroenterologist from Prince Court Medical Center, for being with us here today. Thank you so much.
Thank you for giving me the time.